Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics and emergency medicine, affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of our health talk today is fentanyl rising crisis among our youth. Joining us today is as our guest speaker is Dr. Chris Shreve. He's a PhD um, practicing mental health services, health, traumatic mental health issue, and addiction specialist. He is going to highlight our viewers what are the common issue that is going on these days, and specifically the fentanyl rising crisis. Good morning, Chris, and welcome to my show.
Good morning, Dr. Prasad. Good to be back again.
I know.
I'm always delighted when you email me and ask if I have some time available. And of course, I always try to make it happen. So of course, we're here today on a beautiful summer Tuesday morning, taping our show. And unfortunately, I couldn't be in the studio with you guys today, but certainly next time I'll be face to face with you again.
Sure, promise. Okay.
All right.
Will you please give your introduction to our viewers before we start the show?
Absolutely. I'll keep it brief. At this stage in my career, I'm kind of just enjoying the fruits of my hard labor. I've been in the field for 31, 32 years. I've done pretty much everything. I've taught at universities. I've worked in homeless shelters. I've worked in the high-end private practices. So today, I'm just working out of my house, doing virtual therapy, focusing mainly in area of trauma, addictions, and, overall mental health. And it's kind of a easy life now, just talking to folks on the phone and doing television shows, speaking engagements, and workshops. So that's kind of what I'm doing now, just focusing in really in the area of trauma and mental health and addiction. So that's kind of what I'm doing today at 60 years old.
That is great. You are doing such a good job for our community. And every time, we see the CNN and wherever, all those fentanyl rising prices. So I was wondering if you can highlight our viewers about this whole thing. I know you have a beautiful slide projection also that you can share with us.
We always have a few slides for the show. So, I like to kind of, as the professor in me, I always like to kind of bring some knowledge and some information. And this presentation is really just the latest information and the trends that, are occurring right now. And I think that's what got on your radar, just the spike that's happening with the overdoses with fentanyl deaths among adolescent and young adults. And so the question is, what is fentanyl really? So for our viewers who really don't know what fentanyl is a very powerful opioid-based painkiller. That's in the family of other opioids like that, which include Percocet, Vicodin, Oxycontin, and heroin is the more synthetic, made process from actual opium. But these are all opioid-based painkillers, and they come in various different forms: lollipops, sprays, throat lozenges, tablets or pills, and the illicit illegal fentanyl, which is the majority of what's on the market currently, mostly comes in powder form and may also be compressed into tablets. You might find them prescribed under various trade names like Aztec, Duragesic, and Sublimase, which are the prescribed names of the medication prescribed by doctors. And so fentanyl is very, very powerful. It's actually, depending on the concentration, it can be anywhere between 100 times to 200 times more potent than actual heroin or, let's say, Vicodin. So it doesn't take much to cause a toxic reaction. In fact, some of the overdoses occur by helpers and responders who are responding to folks who are overdosed. And if the fentanyl powder gets in the air, and it doesn't take that much, it can just simply be a few particles that can actually cause an overdose. So that's how potent it is. And so, so that's kind of the concern that we have right now regarding what is happening with fentanyl. Um, our next slide kind of gets into the crisis that I think our show is really kind of getting at, and that what we found in the last couple of years, we've kind of thought we came out of the opioid crisis, that was brought to our attention more than like 5 or 6 years ago. But what we're finding is that fentanyl is still widely used out there in the community. In fact, what we found is that during COVID and the pandemic, it appears that fentanyl was just flooded on the streets in most communities, which led to a number one of overdoses that we found related to the roughly 100,000 people that have overdosed from fentanyl, using fentanyl illicitly. And that's roughly from April 2020 to March 21. So we found that, roughly 100,000 folks have overdosed. So it's the leading cause of death, really, when we look at it from ages 18 to 45. And I think what brought this show to the forefront was the doubling of the overdose rates from 2019, which we see at a roughly 2.36 per 100,000 population, to now 5.49 per 100,000 population in 2021. And in the first 6 months of 2022, we have seen this number continually spike and increase. So that's kind of the impact that fentanyl is having in America. And these are, numbers are based on adolescents and young teenagers and young adults. So do you have any thoughts about any concerns that you've seen in your area, Doc, regarding this fentanyl crisis?
Yes, I am. Among the teenagers here around, there are a lot of overdoses being noticed at the emergency room from the fentanyl. And very interesting fact, I noticed that the powder form of the fentanyls are being laced with the other stuffs to make them more stimulant. And these things, I'm getting my personal experience. I'm getting it from my own, my own family, the grandchildren, going to school, and just like your daughters, they go to the school and bring you. And the same thing here. And that's why I got very much interested about this whole topic. And I wanted the expertise like you to share about what are the contributing factors, how we recognize the overdose and all that. Thank you very much.
Yeah, absolutely. I think that the biggest problem that's contributing to the overdoses is the fact that majority of the fentanyl that's on the streets is imported from other countries. As we were talking before the show, we identified 3 major countries, and that's India, China, and various parts of South America that are able to get these drugs into the United States. And the other, like you said earlier, what's contributing to the overdoses is that because fentanyl is so cheap and so powerful, it's used to it's mixed into other drugs, and that can really, that's what's causing these accidental overdoses, and people really not understanding that what they think they're taking is actually laced with fentanyl. And it doesn't take much fentanyl to cause an overdose. And so we're finding that fentanyl is showing up in pretty much every black market drug that young adolescents and adults are using, such as ecstasy, MDMA, all the ADD medications like Adderall. I suspect also Xanax, some of the benzodiazepines and barbiturates. We're finding that the fentanyl is being laced and mixed into these compounds, and that's what's being sold in the street. So that's why you're finding a lot of these overdoses where you find a group of people who are sharing drugs overdose. And I think it happened a couple of weeks ago. I think it was in Texas or somewhere out west, where there was a group of young people that were found in a motorhome kind of place, and they had all overdosed. I guess they found them the next day, and the deaths were attributed to laced drugs with fentanyl. And because it, causes immediate respiratory failure, because it, blocks that signal from the brain to the heart to breathe. So that's why it's so dangerous. And I think the other reason that we see a lot of overdoses, because, and this came out of the opioid crisis in general, is the over prescribing of narcotics in general. And I think that was the kind of culture that we recognized that we were in, that we were prescribing medications for just about every ache and pain. And I clearly know that once we were in COVID in the last two and a half years, and we've done a number of shows on the pandemic, especially the mental health aspects, we found that many people were relapsing to alcohol and other drugs during this pandemic. And so, of course, I think that certainly contributes to the fentanyl overdoses, especially when the drugs were flooded on the market during this pandemic. And a lot of people were, unconsciously dealing with trauma. The pandemic really changed our entire life. And so I think a lot of people began to medicate their pain, their anxieties, their fears. And that's where I think we see the uptick in these drugs. And so there's a number of factors. But the one thing that I really want to hit on, which I think is the more scary of this whole conversation, and that's the use of social media platforms to push these drugs. And I don't know if you're familiar about this, but I just, in researching for the show, I found some research that, these Instagram platforms, and I don't want to call any one particular out, and there's a few of them, TikTok and Instagram and Snapchat, and, there is a number of, they use emojis as a way to order drugs and to connect with people who are selling drugs on these platforms. And so it's very clandestine, very below the radar. But now that they're discovering that the way that these drugs are being marketed, sold, and distributed is through a lot of these social media platforms. So that's also going to contribute to a number of adolescents who are going to overdose. Because a lot of times they're looking for other kinds of drugs and don't realize that these drugs are spiked with fentanyl. And so that's kind of what we found with the social media. And that was a very startling finding, because all of our kids, many of our kids who have smartphones, are in these platforms, and and get solicited by a lot of these drug dealers to get drugs, or they know they can get access to drugs through Instagram and other social media platforms. And so that's kind of scary, because that way they can get it shipped. They can use different digital coin-based applications like Cash App and PayPal to pay for these drugs, and a lot of that's kind of just falls below the radar. So I think that also contributes heavily to the fentanyl overdoses. We have one other slide that I kind of want to talk about, and that's kind of why I think you contacted me for the show, and that's to talk about the issues related to treatment. You being a pediatric emergency room physician and working with youth and adolescents, I'm sure, I have these concerns that a lot of adolescents and young teenagers are not really feeling comfortable going to the hospitals when they're in crisis. Do you have any thoughts about that, Doc?
Yes, I do have, because when you talked in the earlier slide, that incidence of 23 adolescent overdose, that was in South Africa, very close to I believe it was Johannesburg. Mm-hmm. And that's what inspired me to request you to talk about this. Another incident I'd like to share with you, Chris, is that we went to the Mexico one time, Cancun, and we were sitting in the beach, and I saw this big truck, big bus coming with about 25 or 26 teenagers, spring break for them. Right. And then sitting next, I see that everybody had a bowl full of candies. And I got so interested. I said, what are everybody had different color of candies? So I
Right.
just quickly walked through, and they were all, like little candies, and they were mixed with all these drugs that you mentioned earlier, like
Right.
ecstasy and all that, and they were all, like happy, jumping, and so that incident, then I wrote my article about the salad bowl syndrome. And
Right.
trust me, it is so good to see our teenagers, being happy with the music and all that. But afterward, the consequences are so sad. And
Yeah.
that's why I think we should all, as a pediatrician, as a family medicine practice, I think we should do something to stop this. So our kids, they can have a good academic performance at
Yeah.
school. And I think you are a very important figure in that, the mental health services.
Well, I thank you for that. Your story reminds me of a training I did for the entire Royal Oak School District,
Uh,
fourth through seventh graders school,
yeah,
where they
yeah,
want me to educate them about uh, prescription medication. And you described this bowl that these kids have, and actually the name of the training was
yeah,
called Candy Bowl Caper. And because what these kids will do is they will get drugs from wherever they get them from. They steal them from their parents or grandparents, and they'll get prescriptions for different things, and they'll just toss everything in one big punch bowl,
yeah,
and then they mix it up, and they just grab a handful, and that's what they'll take, and they absolutely have no idea what they're taking. It could literally be, 6, 7, 8 different kinds of medications or drugs in this punch bowl. And, many of them would be probably in the hallucinant categories and some benzos. And who knows, if you get some spiked ADD medication, thinking it's Adderall, and then it's got fentanyl in it, then you can see how all that little partying turns into a disaster pretty rapidly. And so that's kind of what I think, getting back to your question, how do we address this? I think it's really through education, grassroots education to young people and young adults about the dangers of, mixing drugs in different combinations, the dangers of, recreational use of drugs that you don't know, you don't understand, thinking that's a way to party. And I think we have to re-educate people on safer ways to party. We're not going to stop people from partying. We're not going to stop kids from going to spring break. We're not going to stop, a lot of this kind of uses, but we can teach, young people how to be more responsible and more intelligent about their choices. And I think that's kind of how you address this issue. Our society is sending a lot of mixed messages regarding the use of drugs and alcohol. And I think that, we really just have to educate kids without forcing it down their throats and allow them to make good decisions. Our millennials, Gen X, and Gen Zs are very knowledgeable, in tune to a lot of information. They're very information-seeking culture populations, and so we just need to provide them with information, and so they can make these decisions. And I think clean up the drug market. It's bad enough we have these kind of drugs in the streets, the barbiturates and other opiates, but then to lace them with fentanyl, it's almost like it's murder, because whoever's lacing this knows the ramifications of what can happen when people use these drugs. I remember a case not too long ago that was, I think, the first tip off of this fentanyl crisis. It was probably about 4 or 5 years ago. And there was a fentanyl ring that was operating in the Metro Detroit area. And that's what they discovered, that they were intentionally lacing the heroin with fentanyl to artificially spike the dosage, making it more potent. And, this is the sad irony of this thing, is that when people hear about folks overdosing on a particular drug like heroin, unfortunately, they flock to that particular source of heroin. And so, when people, kind of hear in the streets that, someone overdosed on this particular drug, that drug becomes very popular. And because people, I guess, in that opioid seeking world of trying to medicate and numb themselves out, pushing themselves to the edge, right on that edge, not quite overdosing, but right at that edge of completely being numbed out. I think that's what people seek when they use these opioid medications. And if it's spiked with fentanyl, your calculations are off. And so that's why I think that was a very dangerous trend. And I think that just continued to go around the country. And that's what I think really highlighted the opioid crisis and led to all of these overdoses. Yeah, which is the topic of this show today. So that's kind of, what I have in terms of the treatment concerns. The other things that I think that are important to talk about, Doc, there's not much treatment for adolescents around the country and young adults. And I think, you probably realize that too, working in the emergency room systems, because of the, especially if they're like a minor, most detox centers and hospitals, they want, somebody to sign, consent forms. And in many states, adolescents as young as 13 are able to sign themselves into treatment. But when it comes to medical detox, that's usually hospital based. And that gets real tricky as, the hospitals kind of want a parental consent. So if you have a young adolescent who's like on the run, that kind of thing, or living in a youth home or has a guardian, their access to treatment could be denied because of the informed consent. So that's one thing. And like I said, just in general, what I found in the research is that most of these detox centers, they really are not equipped to deal with adolescents. Most detox centers are adult-based, quite frankly. And I've been in the addiction treatment world for more than 30 plus years. And, it's really hard to find inpatient detox facilities for adolescents. And so that's the other issue that I think can contribute to the overdose problem, because you don't have much time to react. And so you really want to get someone to the hospital as soon as possible. But if you can't do that, then I think the other thing that we're seeing in our society, which is a good uptrend, is that we're seeing the use and availability of Narcan. And I know you and I were talking about Narcan before the show started. Naloxone is the ingredient in Narcan. And this is being given to overdose patients to immediately reverse the effects of the opioid. And it works for fentanyl, it works for all opioids, to immediately reverse the effects of the narcotic and to stop the overdose. And so those are being used widely. Most police officers throughout the country now have Narcan as a standard product in their cars. And in fact, I think we were talking earlier about the recent case that happened, I think, in Roseville, where a baby or toddler got access to their mother's heroin and overdosed. The mother was on the way to the hospital, and the police interceded and gave the baby Narcan in the car, and subsequently, stopped the baby from dying. Baby's in critical condition, obviously, but so that's one thing that really helped on the treatment side, especially for folks who can't access treatment, especially folks out in the rural communities and places like that.
So Chris, we have to talk about this issue again because we don't have enough time. I'd like to thank you for coming to my show. You provided us with so much information, and our audience, our listeners will surely, like this video of our talk. Very interesting. I'd like to thank our viewers for watching me today on Health Talk with the guest speaker, Dr. Chris Shreve, PhD. And until I see you all again, have a safe, wonderful summer. I'd like to thank our producer and all of you for helping me preparing this wonderful, interesting topic. for covering this. Thank you again. Thank you, Chris.